Hey Shirley, welcome to the webinar. Are we on the right Zoom ID? I guess we are. Welcome, welcome Meridian Brown. Welcome Shirley. I was getting a weird message that it wasn't letting me in. Good evening, Gigi. How are you? Meridian Brown, Shirley. We will get started in a moment. There's Dr. Joy. Welcome, welcome, welcome. We're hoping everyone's doing well here. So welcome, welcome to the webinar. It is 7 o'clock. This is the doctor's edition. I'm Dr. Rita McGuire, Chief Medical Officer here at Wakana and one of the co-founders. And I'm joined here by Dr. Joy Smith. She is my business partner, one of the rubies in our company, a pharmacist. And you're going to hear from her in a moment. This is a call that we do every Tuesday to really help healthcare professionals and those who may not be in the healthcare arena and what CBD is. We know that less than 5-6% of medical schools, pharmacy schools, chiropractic schools, nursing schools teach about cannabis and how it works in the body. So that's why I get very excited to present every Tuesday to really help our healthcare professionals to be engaged with what their patients are already taking or looking to take. So a little bit about me. I'm an obstetrician gynecologist of over 30 years. I completed my medical school training at Wayne State School of Medicine in Detroit, Michigan. I then went on and did an OB residency at Cook County Hospital. I'm the CEO of RJM Wellness and Rip Rita Fitness, which is a health and wellness fitness company. I'm a global women's health and wellness speaker, as well as a certifying physician for the medical marijuana program here in the state of Illinois. I'm also a member of the Doctors for Cannabis Regulation. It's really exciting to see a lot of physicians that are involved in the legislative part of cannabis as a plant. And again, I'm one of the co-founders and chief medical officer for Wakana for Life. So CBD is really quite popular. You know, many of our patients are asking about CBD. They're wondering if they can use CBD with their current medications. They're wondering if they can use CBD in lieu of their current medications, or maybe cancer treatment or dialysis treatment or any other treatments that they're going and undergoing right now. But what the challenge is, again, is that many healthcare professionals really don't know how to answer these questions about CBD. We know that millennials, Gen Zs are consistently using CBD. It's gaining a lot of popularity because, see, Gen Zs and millennials understand that there is an opportunity to address their anxiety, their depression, their insomnia with a product that won't make them high, right? They can still work, be functional, and have the relief from a organic way of addressing their issues. Baby boomers, you know, it's gaining popularity in baby boomers as well. Why? Because we have a lot of aches and pains. And if you think about what happens to our patients when our patients will choose Motrin or Aleve or ibuprofen long term for their pains, for their aches, we're seeing an increase in patients who are in need of dialysis. See, long-term use of these over-the-counter medications can cause kidney failure. We even are now seeing a lot of people who are having liver failure, having liver issues because of long-term use of acetaminophen or Tylenol. Just imagine every time you have a headache, if you take a Tylenol. Our patients are doing that, right? So this is an opportunity for us to help them choose something different. We know that the average 50-year-old is on about 5 to 7 medications. The average 70-year-old is on 12 medications. And when we look at our patients' profiles, many times it's not that those patients have 6 or 7 disorders, but they have this many medications because of side effects from an original medication that we may be prescribing for high cholesterol, or maybe a medication we're prescribing for hypertension can cause a side effect, which then requires another medication to address that side effect. So this is why this is just such important information to get across. Now, when we talk to many of our colleagues, or when patients talk to us about CBD, many of us are thumbs down, right? I was like that over 4.5 years ago. I never heard of CBD. The only thing I knew about cannabis was marijuana, right? The part of the plant that gets you high. And the reason why so many healthcare professionals are thumbs down about CBD is because we didn't get this training in medical school. The same holds true for pharmacists. The same holds true for nurses and other healthcare professionals, the lack of knowledge. But let's talk about the plant, right? Because there's still a lot of negative stigma that surrounds this plant, quite honestly. The plant, cannabis, is the family. The family has 2 species. One is marijuana. Marijuana is the species that gives you the high, the euphoria, the paranoia. It also gives you the munchies, right? It has high levels of THC, or delta 9 tetrahydrocannabinol. That is the #1 compound that is found in the marijuana species. Then we have the hemp species. This is the part of the plant that gives you the health without the high. See, I didn't know that 4.5 years ago. I didn't realize that cannabis had a side that did not cause a high. Well, it's called hemp. And the reason why it doesn't cause a high is because hemp has a high level of CBD, or cannabidiol. It has very low levels or trace amounts of THC. By definition, hemp is defined as containing 0.3% or less of THC. And then there's different varieties of cannabis, right? There's cannabis sativa, which we're going to be talking about tonight. That's the tall, thin variety. Then there's the cannabis indica, which is the short, stubby variety that many times is the variety that many seek, that want to just lounge and sleep all the time. In the couch is what they call it. And then there's cannabis ruderalis, which is another variety that is now getting some momentum in the cannabis industry. They're looking at different ways of using cannabis ruderalis. Mostly they use it for industrial uses, for clothes, for fiber, and things like that. So when we look at the anatomy of the plant, just think about hemp seeds, right? I'm sure that many of you have seen hemp seeds either in the health food store or maybe in the grocery store. But the seed of the hemp plant has a lot of nutritional values. It's high in protein and fiber and fat, but the seed does not contain what we're looking for, and that's CBD or THC, some of the other compounds that the plant produces. It's really the bud and the flower and the leaves that give us that medicinal or health benefit that the cannabis plant offers. So CBD, again, the legal CBD, the CBD we're going to be referencing tonight, is sourced from the hemp plant or the hemp species. And it was legalized in 2018. It was removed in 2018 from being a Scheduled 1 drug, a very dangerous drug, right? It's right up there with LSD and cocaine and other narcotics. But now that it is legal, containing 0.3% or less of THC and being sourced from the hemp plant, now we can sell, we can cultivate, and even consume CBD in all 50 states. So it is legal. It's something that we as healthcare providers, we don't need to write a prescription for it. It is now removed from the Schedule 1 drug. Another thing that we as healthcare providers have to think about is how CBD can react with drugs and medications that our patients are already on. You're going to hear more about this when Dr. Smith Joy comes up, but just know that CBD is metabolized in the liver, and so it can interact by inhibiting drugs that our patients are on. It can be potentiation of drugs that our patients can be on, but it is through that metabolic pathway in the liver, the P450 pathway, that allows us to help our patients space when they take their medications and CBD. Now, does CBD show up in a drug test? The answer is when our patients are undergoing random drug screens, they're not being tested for CBD. They are looking for THC or Delta 9 THC. There is a small amount of THC, as we stated, in the hemp species, 0.3% or less. And the research shows that it really would take large doses of CBD that has a legal limit of THC to theoretically cause a drug screen to be positive. In fact, they did a study and they showed that those who were taking doses as high as 2,000 milligrams a day, they had 11 to 23% chance of testing positive in their drug screen. So that's why it's important that you know that there are CBD isolates. There are broad spectrum products that contain less than 0.0% of THC. And then there's that full spectrum product that contains the legal limit of THC. But all to say that there are products, yes, that your patients can take where they can pass their drug screens. Even when we talk about topical CBD, the big thing now is when you go for a massage, your patient may be offered a topical CBD massage. CBD that's used topically will not pass a blood-brain barrier. So that is a really good thing to understand, that topical CBD products will not pass through the blood-brain barrier and will not cause a positive urine drug screen. So our colleague, Dr. Sanjay Gupta, really has made cannabis mainstream. And he did that by coming out and making a public apology in 2013, 2014. And his apology was that he had previously in 2009 said no to marijuana, no to pot, no to weed, no to cannabis. But in his travels, in his research, looking at data from Spain and Israel, he found that this plant had been very, very instrumental in helping hundreds of thousands of people that had challenges with seizures, challenges with autoimmune conditions like lupus and fibromyalgia, challenges with cancer, challenges with migraine headaches, and other challenges that we have. Those patients using cannabis had results that were really phenomenal. So he came back in 2013, 2014 and said, we've been systematically misled about this plant. He said, I didn't dig deep enough, far enough. I didn't do my research. And this plant absolutely can be used as an alternative for anyone, any of our patients that are looking for an alternative to their health. Now, the FDA does have one approved CBD product, and that one CBD approved product is called Epidiolex. Epidiolex is a medication that is manufactured by GW Pharmaceuticals for the use of childhood seizures, Dravet syndrome, Lennox-Gastaut syndrome, and tuberous sclerosis complex. This medication costs $3,200 for a month supply. It is a synthetically manufactured CBD medication, but just know there is one CBD approved by the FDA. So when we look at CBD or cannabidiol, I want to talk to you about some of the medicinal properties that CBD has. CBD is an antibacterial. That's why you're seeing so many CBD products being used in facial serums, in topical lotions used for acne, eczema, psoriasis. CBD inhibits cancer cell growth. That's why you're seeing so many of our colleagues that are oncologists that are recommending their cancer patients to use CBD. Why? Because cancer treatment can cause nausea, vomiting, weight loss, loss of appetite. CBD is neuroprotective. It helps to regenerate those damaged nerves from those who may have disorders like diabetes that have neuropathy, or even those who've had seizures and strokes. CBD protects bone growth. So we're seeing a lot of folks who have issues with past fractures, osteoporosis, osteopenia. It helps to reduce seizures and convulsions. It helps to reduce blood sugar levels. It helps to reduce the hyperactivity of the immune system. So those who have lupus, fibromyalgia, multiple sclerosis. It helps to reduce the risk of arterial blockage. So our patients who have coronary artery disease or high cholesterol. It helps to relieve pain, anxiety. It helps with muscle spasms. So those who have restless leg syndrome or multiple sclerosis. It helps to dilate the blood vessels. It's a vasorelaxant, so very instrumental in those who have high blood pressure and hypertension. And then there's other cannabinoids that the plant produces, like CBC, CBG, Delta 8 is the new kid on the block, Delta 9 THC, THCV. All of these cannabinoids that the plant makes synergistically can work with CBD to help reduce inflammation, to relieve pain, to promote bone growth, to help to inhibit cancer cell growth. Lots of studies that show that CBD and along with these other cannabinoids can help the cancer cell growth from metastasizing. And the way that CBD and the other cannabinoids do that is through the human endocannabinoid system. This is a science that was discovered in the early 1990s, but much earlier with scientists in Israel, that when a person consumes CBD or any other cannabinoid, it binds to receptors in different parts of our body that help to send a signal to that part of the body to help reduce inflammation, to help reduce pain, to help our wake sleep cycles, to help to stop, quite honestly, a headache. And so these receptors, CB1 and CB2 receptors, are the major receptors that bind to CBD and send signals. And so when we talk about CBD, we can now understand that it's not a magical potion. It's not a snake oil. There's real scientific data that shows how it works. Even our body produces cannabinoid-like products and byproducts. They're called endogenous cannabinoid. And I get really excited about this because one of the endocannabinoids, anandamide, is found in high levels in breast milk. So I tell all my breastfeeding moms that you are giving your baby the best cannabinoid in the world, anandamide. Not only does it help to reduce infections in newborns, but it is a very calm and relaxing cannabinoid. That's why breastfed babies are so happy, right? They sleep throughout the night most times. Another endogenous cannabinoid called 2-AG. This one is really instrumental and important in reducing inflammation and reducing pain in the body. So the plant makes cannabinoids called phytocannabinoids like CBD, and then the body produces endogenous cannabinoids like anandamide and 2-AG. So there's different ways your patients can consume CBD. There's tinctures, there's water solubles, there's edibles, there are topicals, there's capsules, there's spices, there are cartridges and pre-rolls and flour. It just depends on how your patient wants to consume CBD. So when we talk about the transmission of CBD and other cannabinoids our patients may consume, it's a retrograde transmission. And this is why we find that in disorders like attention deficit disorders, convulsions, seizures, multiple sclerosis, Parkinson's, any condition that has a hyperreactivity to it, this really explains why these cannabinoids work so well. Because instead of sending a signal from a presynaptic to postsynaptic neuron, then to the area of the brain or the central nervous system, the endogenous or the endocannabinoid system works in a retrograde fashion. So those receptors are first bound in the postsynaptic membrane or neuron, sends a signal backwards to the presynaptic neuron, and then to any area of the brain and central nervous system. So it truly is a fascinating science. It is a science. It's not a snake oil. It is not a magical potion, but it truly works in different pathways in our brain, our central nervous system, and our immune system as well. So this is just another diagram of when our patients consume CBD, they bind to receptors, and then those receptors send a signal to any area that is out of balance, any area that is inflamed, any area that's causing our patients pain. When you're looking for the science, use PubMed. PubMed is a great way of looking for articles, looking for your data. When patients are asking about different conditions like gastrointestinal disorders, like ulcerative colitis, Crohn's disease, you can find this information. The same holds true for those who may be undergoing cancer treatment. Again, CBD, cannabis as a whole reduces the or inhibits cancer cell growth, cancer cells from metabolizing. It also helps with the side effects that many of our patients have when they're undergoing cancer treatment, the nausea, the vomiting, the loss of appetite. And then anxiety, another big disorder that is really plaguing a lot of our patients during this pandemic. We see that CBD absolutely can be used for the treatment of anxiety disorders, as well as difficult to treat pain, neuropathy, sciatica. We talked about radiculopathy last Wednesday on a webinar, talking about really serious, difficult to treat pain. CBD can come in and reduce inflammation and pain through different pathways in our body. So hopefully you have a little bit of a better understanding about this plant, the fact that this plant has two species, and the hemp species is absolutely a area where CBD can give our patients the health without the high and give them an alternative for their wellness. This is my email. If you have any further questions, any additional inquiries, you can email me at ritamd@wakana.com. So right now I'm going to bring up my colleague, Dr. Joy Smith. Dr. Joy Smith is a pharmacist, a lead pharmacist here in Chicago at Stroger Hospital. I was about to say Cook County, no longer Cook County, but Stroger Hospital. And she is a Ruby here with our company at Wakana. She is a wife and mom of an amazing little girl that just graduated from kindergarten. So proud of her. Dr. Joy Smith, you can take it away.
Thank you so much, Dr. Rita. And for those of you all who don't know, my daughter is Dr. Rita's biggest fan. She thinks that's her best friend. So it was only fitting that Dr. Rita mentioned her on this call this evening. But good evening. As Dr. Rita said, I am Dr. Joy Smith. I'm a pharmacist I still call it Cook County, Dr. Rita, so don't feel bad about it. And in fact, I don't know if you can see it, Cook County Health is the new name on the side of the building. So you are right on target. So I got my doctorate in pharmacy from Florida A&M University, and I've been a pharmacist now for 8 years, well, 9 years, working at the county for 8 in various settings. But I think any setting that I went to, I always had this zest for knowledge about natural healing. So of course, pharmacy is what I have my degree in. Pharmacy has taught me a lot. I understand that there is a place in therapy for medication, but I also know that there are plants and natural botanicals that can really help us to heal from the inside out. So having that knowledge and kind of knowing that made me pursue further certifications, such as my integrative nutrition health coach certification, my aromatherapy certification, and just begin to open my mind to the knowledge of what's out there. My brother got diagnosed with cancer in 2014. So he really kind of started that journey, not only for me, not only for himself, but for the rest of my family. We just really began to take a different look at what we put into our bodies and how we choose to heal our bodies. And once Wakana found me, the International Society of Cannabis Pharmacists came around, and I just was so excited to be a part of a group of like-minded professionals, like-minded pharmacists who understood that there is medicinal benefit in the cannabis plant. It's been stigmatized for way too long, and I'm just excited to be a part of that. As for Wakana, I'm a Ruby dispensary owner and the vice president of compliance. So I just love it here. I love the knowledge that I gain. I learn something new every week, every webinar, particularly when I'm on with Dr. Rita. So I'm learning just like you all are, and just excited to be here to provide some more knowledge. So Dr. Rita talked at length about how CBD can impact different disease states, how CBD can help to support or help to get your health on the right target when it comes to addressing certain concerns. And some of the most popular reasons that people use CBD happen to be anxiety, inflammation, tension, headaches, and the list goes on. But these are some of the popular reasons why some of your patients may be seeking out CBD. So in this cross-sectional study of cannabis users, we identified the pain, we identified the anxiety, we identified depression as to why people are using CBD. And with chronic pain being the #1 cause of disability and disease burden globally, people are looking for answers. People are not trying to take opioids every day for longer than they should for anything other than breakthrough pain. People with anxiety are looking to calm that noise, especially in light of the pandemic. People with depression are looking to calm that feeling as well, and looking to address it, because depression is running rampant now with the deaths from COVID, with people losing their jobs, and just the overall not being able to interact with our families, not being able to interact with our friends. Things are getting back to normal now, but we did just come off of a year, if not more, of isolation. And that really takes a toll on your mental health. And speaking of the depression, the Journal of American Medical Association talks about how the prevalence of the depression symptoms was 3-fold higher during the pandemic than before. And the depression is impacting the people that I work with on a daily basis. So I don't know if the healthcare professionals on the line are in private sectors or in public sectors. I work at the Cook County Hospital, where we decide that we are going to treat people regardless of ability to pay, regardless of insurance, regardless of any of those things. And so those are the people that seem to be disproportionately affected by those lower socioeconomic resources, those greater exposures to stressors, i.e. losing jobs. So a lot of the people that I deal with are dealing with low health literacy, dealing with all of the other stressors that we mentioned, and they're having the greater burden of depression symptoms. So as these people are having the greater burden of depression symptoms, they have low health literacy, they don't know how to interact with their doctors in a way that would get them everything that they need. Some of them are looking to turn away from prescription medications simply because of the side effects that they're experiencing. Some of them don't know that they have other options in the form of botanicals and plant-based healing. So then the question becomes, what can we use? How can we feel better without taking medications that cause numerous side effects. And then the doctor's question on the other side is, okay, I hear about this CBD, I hear about essential oils, I hear about botanicals, but do those cause drug-drug interactions with the medications that my patients are on? This is a question that a lot of healthcare professionals have. And the short answer to the question is yes. CBD, essential oils, other botanicals have the potential to interact, but there are ways in which you can space out the medication from the CBD, space out the medication that the patient's currently taking from essential oils, space out the medication that the patient's currently taking from whatever herb or botanical that they're choosing to take to address their symptoms, and make sure that they're not traveling down the metabolic pathways at the same time. So speaking of those metabolic pathways, let's travel back into nursing school, pharmacy school, physical therapy school, medical school, and remember these P450 enzymes. So these CYP450 enzymes, these 6 are responsible for metabolizing about 80 to 90% of the drugs that our patients are taking, right? So these are the most popular. And what we know is that CBD is a substrate of 2C19 and 3A4, 2 of those popular enzymes, but it inhibits the metabolic pathways of 2C9, 2D6, and 3A4. So what's important to note, like we said, there is a potential for drug interaction, but that CBD is going to inhibit those metabolic pathways. It's only going to cause a problem if those drugs are not spaced out. If the drugs are not traveling down the metabolic pathway at the same time as CBD, then you can avoid that drug interaction. That's similar to medications that patients are on that do interact with one another. It might be spaced out, one in the morning and one in the evening, or at least 2 to 4 hours apart. These are ways that we can stop being scared of recommending things like CBD, stop being scared of putting botanicals out there as a method for relief, as a method for controlling some of the medication, some of the disease states that we have, and being able to really feel better, being able to give something to our patients that is not harmful. So I work in the outpatient setting, and a lot of these conditions and a lot of these medications are things that I see on a daily basis. And some of you all may see them too, especially in the populations that you work in. So hyperlipidemia, hypertension, patients who are in the anticoagulation clinic, which is a clinic that I worked in addition to my outpatient pharmacy time for about 5 years. Asthma and allergy, diabetes, pain medications, the list goes on and on. But the point being, these medications, when taken together, can interact with CBD, but we want to make sure that we space them out. I can't stress that enough. Make sure we space the CBD out from the medication that the patient is taking. And let's make sure that we educate ourselves. Dr. Rita comes on and gives us extensive information about CBD. There are articles, as she's shown you on your favorite search engine, PubMed, any other search engines that you may have access to as a part of your database with your employer. These are important things to know so that we can begin to engage our patients and educate our patients from a holistic perspective, as opposed to staying closed-minded and not really catching on to what the new trends are with regard to complementary and alternative medicine. So alternative medicine, who's using it? Why should I care? I am a practitioner. I might be speaking for some of you all. I'm a practitioner who's been practicing forever. My patients love me. I haven't had any issues. I don't want to change what I'm doing. Who's using alternative medicine and why should I care? Well, the treatment trends show you why you should care. So if we're looking at just botanicals specifically, that blue on the bottom level, botanicals from 2014 to 2025 are increasing in use in terms of treatment trends with alternative medicine. And botanicals include any plant-based component that has a medicinal benefit. So CBD can be considered a botanical. Essential oils can be considered a botanical. And as we start to move forward from only using prescription medications to patients and now healthcare professionals catching on and saying, there's a way to provide some complementary care for my patient that can help ease some of those symptoms, that can help ease some of that pain, ease some of that nausea, ease some of the other issues that we're having that some prescription drugs might make worse by creating other side effects. And notice, I'm not somebody that's advocating against drugs. I just know that there is some other way to make sure that we're addressing some of the concerns that we have in addition to some of our prescription medications. It's about having a holistic plan and not just one that's one-sided. So you heard me talk about essential oils and aromatherapy, and that was my first love before I even found out about CBD, when I was still one of those pharmacists that said, I can't touch the cannabis plant, I can't look at it, I can't even advocate for it because I'm going to get in trouble. So essential oils were my first love before I got educated and understood that the cannabis plant had medicinal benefit. And these essential oils are volatile aromatic liquids that come from plants. And they can come from the roots, the seeds, the resin, the bark, the flowers, just various parts of the plant. And they're very potent, very volatile, and very versatile. We're able to use essential oils for many, many things. In a diffuser, some can be used internally. We can use them topically. And there are so many different applications that we can use essential oils for that can really impact our wellness. So for those of you all who haven't heard this story, you'll be in for a treat. For those of you all who have, just indulge me for just a moment. But this particular picture is of a doctor in the times of the bubonic plague. And so, of course, they had on masks that looked like beaks to, protect their faces and protect themselves from inhaling any of the airborne microbes from the bubonic plague. But they also had these long robes and hats, making sure that they were fully covered. Because anybody that got in contact with the bubonic plague was basically dying instantly. Couldn't be in any area where the bubonic plague was where you wouldn't catch it. And so this doctor doused his robes, his mask, his everything with a specific essential oil blend. And that essential oil blend was actually created by some perfume and spice merchants who were around during the bubonic plague. And because of the plague, people were losing their jobs. Because of the plague, people were losing their families. Because of the plague, these perfume and spice merchants no longer had people to sell to. And that sounds eerily similar to what's going on now, but I'll go on. So once they were caught stealing from the graves and the homes of the people who are dying of the bubonic plague, the judge said, listen, if you can tell me how you got into these people's homes, took their things, got out safely, and didn't catch the plague, I'll let you go, because it's just fascinating to me. And so what they said was they reiterated who they were. We're perfume and spice merchants. We know how to combine different perfumes and spices and oils to provide medicinal benefit. And we combine these oils together in order to douse our faces, put it behind our ears, our temples, our wrists, so that we wouldn't catch the plague. So as that story has been adapted over time, and as essential oil blends have continued to evolve and essential oils have gained recognition over time, it's just so fascinating to know that this happened tons and tons of years ago. And even our drugs are the new kids on the block. So botanicals have been used for a very, very long time. And I think it's just important to bring out that history and that knowledge. So when we talk about essential oils and how they work, essential oils travel through the olfactory neurons, through the nose, into the olfactory bulb, and travel to the limbic system of the brain, which we know is responsible for memory, responsible for mood. And that limbic system then sends signals to the rest of the body that can control how tired you are, how happy or energized you are, how sedated you may feel, and a host of other emotions and a host of other feelings that come straight from this limbic system. So limbic system is responsible for why you may smell a dessert that your grandmother used to cook and instantly have a memory of her, or smell a perfume or cologne that a loved one used to wear and then begin to recall things that you've done with them or how you've interacted with them. And that's just what happens when we smell essential oil. Essential oil can be paired with what's called a carrier oil, and it can be put on an area of discomfort onto the skin. It can be paired with a carrier oil and some peppermints. Sometimes tea tree can be used to swish around the mouth and create your own mouthwash. There are tons of ways to be able to use essential oils. And as we continue to research and as we continue to learn, we know that essential oils can provide benefit to us. So the Asian Pacific Journal of Tropical Biomedicine puts it like this. They say once essential oils are in the system, they remodulate themselves and work at the site of malfunction. So basically, whatever is going on in the body, the essential oils know where to go. They know how to fix it. They know what to do. And once those permutations occur, relief from different ailments like depression, we talked about that earlier, indigestion, headache, insomnia, skin ailments, and more. These things are affected by the use of essential oils. And so what's important to note, and I have another quote that I want to read to you all, What's important to note is that essential oils are found to be more beneficial when other aspects of life and diet are given due consideration. And the way that I interpret that is you can use all the essential oils in the CBD that you want. But if you're eating processed foods, if you are not taking care of your body, if you're not consuming enough water, if you're not exercising, all of those things are in vain because it's going into a dirty canvas. You can't go onto a dirty canvas and create a masterpiece. So creating an environment in your body where you're able to accept these botanicals, you're able to accept these things that know what to do once they get inside your body, but sometimes can't because there's too much to get around. All of this stuff works together. It's a holistic thing. So I was reminded of Hippocrates. He says, let food be thy medicine and let medicine be thy food. And the extended version of that is, I will apply dietetic and lifestyle measures to help the sick. This is his oath. I will apply dietetic and lifestyle measures to help the sick to my best ability and judgment. I will protect them from harm and injustice. It's a holistic thing, y'all. There's injustice going on where all we have in our communities is fast food. And then we go to other communities and there's a fresh market and there's this and there's that. So we want to make sure that we are not doing an injustice to our body by what we decide to put into our temples. So I get kind of, worked up about that because we don't have the resources. And when we do have access to the resources, we can't understand because it hasn't been taught to us. But now we know that in order to receive the full benefit of botanicals, we want to make sure that our bodies are the canvases that can accept them. Our bodies are the environments that can accept them so they can get in and do what they need to do. So speaking of them doing what they need to do, our essential oils have chemical constituents in them that can kind of mimic some of the actions of some of the medications that we are taking and have other healing properties and benefits that we can explore. So if we're talking about, I'm going to get a specific chemical constituent. If we're talking about the aldehydes, they have the potential to be sedatives, to be anti-inflammatory, to be antiviral. On here on the right, you'll see that citronella, it falls into that category of the aldehydes. Melissa, eucalyptus, lemongrass. If we're talking about monoterpene alcohols, which can be antiseptic, antiviral, we'll go over here to the peppermint, the eucalyptus, the thyme, the tea tree. So you can see that on the left-hand side, these chemical constituents are listed. And then on the right-hand side, you see essential oils that you may have heard of before that are able to achieve those things that you see on the left. So again, essential oils, cannabis, botanicals are not the new kids on the block. In fact, the medications that we learn so much about are the new kids on the block. That endocannabinoid system that we didn't know about in medical school, pharmacy school, dental school, physical therapy school, whatever school that you went to as a healthcare professional, that has been around for tons and tons of years, and it's been inside of our systems. So we need to make sure that we're educating ourselves and opening our minds to these new opportunities for enhancing our wellness. So some essential oil safety considerations, and some of these translate over to CBD, but just essential oil safety considerations. Don't apply to open wounds. Keep away from the eyes and wash the hands after use. Patch test a small area or dilute. Washing the hands is so important because oil and water don't mix. And I know as a healthcare professional, we're used to going to the eye wash station. If anything happens, that eye wash station isn't going to do anything for you because that water and that oil are not mixing to be able to pull that oil out of your eye. Similar to when our patients are using topicals and we want to kind of patch test to see if there's a sensitivity, we're going to patch test a small inconspicuous area such as the back of the arm, the back of the leg, something that if there is a sensitivity, it's not readily visible. Just to see how that patient interacts with either that topical CBD preparation or essential oil. If your patients are pregnant, nursing, or have serious medical conditions or are on medications, specifically for the medications, running an interaction check with your pharmacist with cannabidiol and the medications that the patients are taking. What I found in those interaction checks is that most of the time, it's the medications that are interacting with one another and the CBD isn't. There is interaction potential with the CBD, but I think it's just important to note that you can definitely suggest CBD as a relief for your patients without compromising their health and wellness. We talked about the spacing between the medications and essential oils, medications and CBD, just to ensure that those things aren't traveling down the metabolic pathways at the same time. More is not better. Start low and go slow. Make sure you increase gradually with both essential oils and CBD so that you can figure out exactly what your sweet spot is, because there is no one person that's like another. Everybody's metabolism is different. Everybody is built differently, and everybody may have a different threshold by which they need to take their CBD or use their essential oils to experience maximum benefit. And when you're diffusing essential oils, make sure that you diffuse for about 30 minutes at a time. So one way to kind of troubleshoot that is you can diffuse it straight for 30 minutes and then walk out of the room. You can have an intermittent setting to make sure that it's on for 1 minute, off for 1 minute. Or, just move it further away from you because you don't want to overwhelm your senses during this time while you're using the essential oils. So with that being said, I am so glad that I got to talk with you all this evening. I got kind of worked up about the food being medicine and medicine being food, because I think it's really important that we understand that there are ways for us to heal without harm. So thank you, Dr. Rita, and I'm going to give it back to you.
Fantastic. Thank you so much for all of that information, as you really do provide every single Tuesday night. If there's any questions, we'll entertain questions at this time. You can put your questions right there in the chat box. We also want to know if there are any healthcare providers on the line. You can put that in the chat. Let us know what field you're in and who invited you. We really would love to reach out to you one-on-one at a later date to let you know more about our medical advisory board that we have here. Really looking for our advisory board to start doing some clinical trials with our products and really getting information from other practitioners and healthcare providers. So if there's any questions, put them in the chat or the Q&A area. I don't see any at this point. Yes, Janine, excellent, excellent presentation, Dr. Joy, and excellent points. So we have an 8 o'clock webinar for those who are on and want to hear more about our business, our opportunity, our leadership, our products, and that Zoom ID can be given to you by the person that invited you on the 7 o'clock, and we would love for you to join us. We try to make our webinars short and sweet because we are very mindful that there are folks that are in different time zones and it can get late. But Dr. Joy Smith, is there anything else that you wanted to add?
I think that's it. I was a little longer this evening, but I was kind of feeling the spirit. So I will continue.
Wonderful. Thank you so much. And we will see you next Tuesday. If you are a business partner, please try to just engage healthcare professionals that you know are looking for options for their patients, want to know more about CBD. And 7 o'clock every Tuesday evening, we will see you. Be well and be safe. And we will hop on at 8 o'clock in about 10 minutes. Good night, everyone.
Good night.